Good evening, everyone. I am so pleased to be with you here tonight. I'm bringing you regrets from my colleague, our colleague, Tracy Curtis, who had a Rotary Board meeting tonight and could not be here with you. My name is Marva Wisdom, and I'm moderator for this, our Finding the Balance During COVID-19 session. We are here with you until about 8:15, where we'll take your questions, as many as we can. Just to let you know that we have exceeded our capacity of 1,000 on our webinar, but Facebook is open. You can access us live on Facebook at facebook.com/CMHAWW. That's CMHA's website. If you go on to that website, you'll be able to access our Facebook Live feed. We began bringing you this monthly webinar as a support for a Bracelet of Hope and to fill a need for information around COVID-19 and finding the balance. And so many of us are struggling. And so I'm just going to, before we fully get started, do a land acknowledgement, because we really need to be mindful of where we are, and we need to make sure that we're centering and we are honoring those whose lands we occupied. And while we meet today on a virtual platform, we want to take this moment to acknowledge the importance of the lands we call home, the ancestral ceded and unceded territory of the Inuit, Métis, and Indigenous people. We must reaffirm our commitment and responsibility in improving our own understanding of local Indigenous culture. And when we understand, we must seek to learn more and explore what action we must take to advance truth and reconciliation. We here and all of us that are on the call tonight as part of this panel, we do reside on the ancestral and treaty lands of the Mississaugas of the Credit First Nation, of the Anishinaabe people. And from this place, we are committing to you that we want to embrace inclusion and we want to build cultures of belonging. We're very, very excited, and we thank Allison and Tanya. They're both in the background as we have the streaming of the webinar, and then we have Facebook, as I mentioned to you. And we, of course, have returning webinar members, and that would be Helen Fishburn. And Helen, of course, is CEO of CMHA, Waterloo, Wellington. We're very excited to have Helen, of course, as always. And then we have Dr. Anne-Marie Zajdlik. And I'm not even going to go into the details of their introduction. Our special guest this time around, again, for the second time this month, is Dr. Nicola Mercer. And Dr. Mercer, of course, is our medical officer of health. We're so excited that she made time out of a super busy schedule to be here with us twice in April. We usually have this the first Tuesday of every month, but we recognize what is going on in our community, in communities across the country. And we also recognize that there is more information to be shared, and we're happy to share that information with you. So I'm not going to go into the details, CV. I think you already know, because you've been coming and listening and asking questions on a continuous basis, because we have so much to cover and so many people listening. I'm just going to go through housekeeping rules, and then I'm going to ask each of our speakers to provide some opening remarks, and they can add a little bit about what they do when they provide their opening remarks. So, housekeeping rules. You may be joining us either on Zoom webinar link or via the Facebook Live broadcast that I mentioned earlier. We are ready to receive your questions for either platform. We're asking you to feel free to type your questions in the Q&A section of either Zoom or Facebook. And we're going to do our best to answer as many as possible. But I'm going to tell you now, we already have hundreds of questions. And so, not hundreds, I think close to 100 already. If we can't get to them live, we will endeavor to answer them at our next webinar, or you can see information posted. And I know Dr. Zajdlik on her Facebook, she's answering a number of questions as well in between. We are recording this webinar and it will be posted on CMHA's Waterloo Wellington webpage and the Bracelet of Hope, as well as Dr. Zajdlik's Facebook pages. So you will be able to access this. Give us a couple of days though to get it up and running. So let's start the discussion, and we'll start it with opening remarks, and we'll start with Helen Fishburn, CEO of CMHA, and then we'll go to Dr. Zajdlik, and then we will go to Dr. Mercer.
Thank you, Marva. Good evening, everyone, and thank you so much for joining us again as we continue to find our balance through this pandemic life. We decided to add a special edition to our webinar series tonight for a few reasons. First of all, we're really concerned about the sharp spike in cases locally. In Guelph, Wellington, for example, we've seen a quadrupling of positive cases in the last couple of weeks, from 40 to 160. There's been also a serious uptick in positive cases in Waterloo region as well. We've also been watching our healthcare system creeping closer and closer to the capacity limits. Can you imagine having to make the incredibly horrible decision about who gets care in the hospital and who doesn't based on those limited capacity? That's where we're going. Of course, all of this combined with recent decisions about enhanced stay-at-home orders, closures, restrictions, have made the third wave the most painful of all for all of us. We are seeing and feeling that pain everywhere. We're also seeing it in everyone's overwhelmed exhaustion, not experiencing joy in their lives, the rise of conspiracy theories, anti-masker movements, and a sharp increase in mental health and addictions presentations across the board. So tonight's session will provide you with the most up-to-date and reliable information so you can break all of this down, stay the course over the next few weeks, and ensure that we're doing everything we can to support each other and protect our mental health. So stay with us.
Marva, I think you're on mute.
We're just going to move to you, Emery. Thank you. And then Nicola. Yes. Thank you.
So people are going to watch me with my consternation on my face as I answer questions. There's so many questions tonight, so I'm going to focus on answering those in the chat and also answering them with Dr. Mercer. So I've been telling my patients all day today, this is the storm before the calm. And it's a big storm. It's probably the greatest storm we'll have to go through with this pandemic, but it's coming with the introduction of vaccines. Canada has already vaccinated 25% of our population. Like, that is awesome. And that number has really increased over the last week. There are 10 million people vaccinated in Canada. Guelph, Wellington-Dufferin, thank you, Nicola Mercer, for your leadership, has vaccinated 28.8% of their population. As we creep closer to 50% and 60%, we're going to see the numbers come down, and we're all going to relax and realize we're getting to the end of this. We'll talk a lot tonight, I think, about vaccines, your concerns about the AstraZeneca vaccines, the changing guidelines and how confusing that might be. Give us your questions.
That's great, Emery. Thank you. Dr. Mercer.
Thanks, Marva. I think one of the challenges that I find when I come onto these and I get the questions is that there are different camps on different issues. And I'm going to just start with talking a little bit about schools, because I know that's on a lot of people's minds. And no matter what I say, I can guarantee you that half the people that are listening are going to disagree with whatever I say. If schools are open, I have half the people writing me emails telling me to close them. And if the schools are closed, I get the other half emailing me and telling me to open them. It's a very, very personal issue. It's an issue that touches so many people. So I just wanted to just start with just talking about a little bit about schools and really the philosophy. And I think the first point has to be that children should be in school. I don't think there's a public health person out there who is working that isn't heartbroken that our children are not in school. I mean, all we have to do is look and see, the impacts, the mental health impacts over the past year, the impact on their education, and then the spin-offs on the families. And for many, many children, school's a safe place and home is not always a safe place. And so children should be in school. So the decisions that have been made over the past year, really just over a year when all of this started, have been just contrary to everything that we want and we are taught. So when I was on 2 weeks ago, I started off by talking about how I just closed the schools and the impact that was going to have 2 weeks ago tomorrow. And our cases have continued to rise, and we have continued to see really high case numbers. What I can tell you, though, is I'm starting to see a hint that things are getting a little better. Okay, so that may, the numbers don't look great yet, but we were practically on a vertical climb over about a 2-week period. And now I see a plateauing, and that gives me hope. It gives me hope that we're starting to make an impact with people staying home and staying with their own families, because this is a disease of people. We actually can do something to stop it. And at the meantime, we also have to vaccinate as many people as we can, so that when we come out of this isolation, of this thing that feels so totally not normal for all of us, that we're all staying away from the people that we love, that we'll be able to do so safely. So there's going to be a lot of questions tonight. I know there's going to be a lot of different answers, and I'm sure that we'll give you the best that we can and tell you what we know.
That's great. Thank you, Dr. Mercer. Thank you both. I'm going to start with the two of you in conversation about AstraZeneca. And the reason for that is because there's so many questions, and every day it seemed like there's something different that has arisen. And so with Dr. Zajdlik and Dr. Mercer just talking about that in AstraZeneca, and then once you're done talking about AstraZeneca with the anxieties that come along with that, I'm going to ask Helen if she could just share a little bit part about that mental health piece. And we're talking earlier about a New York Times article about languishing and what that means when it comes to mental health. So if you can just share a little bit, maybe starting with you, Dr. Mercer, and then Ray jump in wherever, just chat for us a little bit about AstraZeneca and what people are thinking, what they should know, and what you know.
So, I mean, I think the first thing is that if you'd have told me a year ago that we would have had a vaccine for COVID, I would have said no, and we just didn't produce vaccines that quickly. And I think the Novavax that's coming along is a little more traditional one. So the fact that we have 4 vaccines right now in the world, well, in North America anyways, that are being used is really quite remarkable. So the AstraZeneca, which is produced by Oxford University Group, is really the result of a lot of research. So all of the vaccines that are out now, they're all really based on cutting edge science, things that have been in the background and that have been worked on for a long time. So as we've been using these vaccines, and the first thing to remember is that tens of millions of people have been vaccinated with all of these vaccines, and in particular with AstraZeneca. So the United Kingdom is a country that's certainly vaccinated a lot of people right down to younger ages. They were giving it out right from the get-go. And yeah, I agree with everyone that when we saw, and they've changed the name now, it's called Vaccine-Induced Thrombotic Thrombocytopenia. When they had those first cases, they didn't know. I mean, the scientists and the doctors who found those first cases, they didn't know what was causing it, and they didn't put it together right away. And so, and when they did, those people weren't treated either. So, because it was just such a rare event. Nobody had seen it. These were just such, once in a career events that it took a while for scientists to know what to look for. Now we know what to look for. So now we're actively and aggressively monitoring for it. And all doctors are very much aware when it comes to AstraZeneca to look for this, because there is a treatment for it. This very, very rare event. So I don't know about you, Anne-Marie, but what you tell your patients about this one, about how rare it is.
So the risk of having VITT, what you just explained, it's between 1 in 250,000 or 1 in a million of vaccinated people. In medical terms, that is infinitesimally small. That's an extremely rare event. Most of the medical interventions, vaccines that people have received come with much higher risks than that. It's good news that we can treat that condition. And so the risk of dying of that condition has come way down. And I think it's a good idea if we talk a bit about what to watch for after vaccination and make sure that people attend the emergency room if they develop symptoms. I'll throw it to you, Nicola, but first the main symptom, and I think it's between it's well after day 4 or 5 on to day 10 if you have a headache. So the venous issue that occurs in the brain, I think the headache onset is 4 days after vaccination, but you can develop, and very, very rarely, a clot in the lungs, which will cause shortness of breath and possibly swelling in the lower leg, because the clot occurs in the leg first and then goes to the lungs. So I think you can be really reassured that this is a great vaccine. Get it if you can, if you're eligible. It will protect you from getting serious illness from COVID-19. Right now, those variants, man, are they ever nasty. It's heartbreaking hearing about young people who are ending up on ventilators. It's heartbreaking hearing about what's happening in the ICUs, in the hotspot areas. And it's heartbreaking to hear about what's happening to the physicians and the staff that are trying to take care of these folks. You are at much, much greater risk of getting COVID-19 right now without really breaching any protocols. I mean, where people think they're staying safe, but they get COVID. And then you are at much greater risk of developing serious, serious complications if you do get COVID. That risk is much higher than the rare risk with this vaccine.
And I just to add to it, I'm also a travel doctor. So there's a vaccine for yellow fever. And a lot of people who go on exotic trips, they might go to Brazil or they might go to Africa or parts of Africa. They come in and they want to have the yellow fever vaccine. And I tell them the risk, depending on their age, is anywhere from 1 in 20,000 to 1 in 100,000. And people don't hesitate. Oh, it's rare. It's not very common. And the risk for the yellow fever vaccine, if you get the event, is actual death. So that's an example of a vaccine that people have and we give and we talk about it, and we explain the risks and benefits, and people don't hesitate. But with a risk of about 1 in 250,000, people seem to think that's very worrying. I don't want to minimize. I don't want to minimize that, but at the same time, I want to say that right now, it is a very good vaccine. It is shown to prevent severe disease, hospitalization, and death, and that's what we all want. We want to stop people from ending up with severe disease. We've had people now who need lung transplants after having COVID because their lungs are so badly damaged, and they're not old. So really, we need to take this seriously. The AstraZeneca, if you can get it, it's a great vaccine. If you can get to a public health clinic, we have Moderna, we have Pfizer. They're all good vaccines that will prevent you from having serious disease, being hospitalized, and dying from this disease.
So if someone has Moderna as their first vaccine, can the second dose be AstraZeneca?
That's a really good question. So that's
called. I was asking that question.
Yeah, that's called heterogeneity with vaccines. So this is one that what I say today might be wrong in a few months. Right now, we're trying to give the same vaccine twice, okay? Because that's what most manufacturers say. But I can practically guarantee you that over the course of the next months or a year, we're going to learn a lot more about what I call switching vaccines. So maybe you have an mRNA vaccine followed by a viral vector vaccine like AstraZeneca, or maybe a protein subunit vaccine, or so we don't know the answer to that. I think it's more common though to have the 2 mRNA vaccines interchangeable. So there is, if you had a Pfizer, for example, and there wasn't any Pfizer, the rule is to give the Moderna. So we're not doing that routinely in Canada. I wanted to say that right now. We've managed to be able to follow up, but it is possible.
That's good to know. And the other question, just pointedly around AstraZeneca, is for people who are pregnant or women taking hormone replacement treatments. What are the comments on that? Can you discuss that?
Well, I think Anne-Marie and I were talking about this just before we came on the air.
Emily has a question for you about that.
Yeah. So I say the first thing is that pregnant women. Okay, so if you are pregnant and you are listening, please, please be careful. We know that pregnant women have a much higher incidence of ending up in our ICUs. We're seeing that now. It is a topic of really active discussion at the ministry. It would not surprise me sometime in days. I'm not thinking, weeks or months, but over the next number of days that pregnant women will be announced that they get to be vaccinated. And that would mean usually through a public health clinic, probably Pfizer, Moderna. But the important thing is that we all recognize that pregnant women need to be vaccinated. Most pregnant women are under 40, not all of them, but most are, which would mean the Pfizer or the Moderna, because AstraZeneca is for 40 and up.
That's good to know. Okay, that's great. Thank you both so much for answering that. I know other AstraZeneca questions will come up. I think you were very comprehensive in, I think, addressing some of the potential questions that will come. And later on, as you said, a week from now, things might change a little bit. And that's why it's important that people really educate themselves. I'm going to turn to Helen for Helen's comments. And but before you comment, I'm going to put a bug in your ear. Kathy writes that her 91-year-old parents, one's a long-term care and the other is in a senior's residence. They both had their shots, and yet they cannot visit each other freely or visit other residents. She says she's only seen her father on Zoom and visited with her mother, who suffers from dementia. And that's been over a year. And their mental health is really suffering, as is their physical health. Very, very concerned, even with masks on faces and face shield, that there's no chance that there's an opportunity for that contact. They have a quote here that there's nothing that you can do about that, but why, when vaccinated and locked away from the world, have seniors no freedom?
Well, at this point, it's really about protecting seniors from the rest of these really nasty variants. So what we know, even if seniors are vaccinated, the utmost protection is 95%. So we know that there are still seniors that are vulnerable, even when they are fully vaccinated, particularly with these new variants of concern, which we've just heard from both Nicola and Anne-Marie, are absolutely nasty and insidious. So it's really a protection of our most vulnerable population. And that is really our seniors right now. I'm so pleased that most of our seniors are doing better. We're not seeing those outbreaks in long-term care homes. We are not seeing the deaths that we were in the first wave and second wave. But make no mistake, I certainly hear, and we all experience, how hard it is to stay away from our seniors that are in congregate settings, especially when they're vaccinated, because intellectually you know that they're safe and protected, but right now it still isn't safe to mingle. It won't be long, and we'll be back mingling with seniors and back with our community. It's going to be a short period of time until we can get the rest of the population vaccinated to a much safer level. And then really we'll have a much better chance of winning against the variants of concern, which right now are still dominating in our community. So in the meantime, continue to do, FaceTime, phone calls, care packages, letter writing, all the things I'm sure that you're doing already, and know that the next window is going to be very brief before we're able to have those safe interactions.
Thank you, Helen. And tell us a little bit about languishing. That's a new word for me today.
Yeah, languishing is interesting. One of our managers, Brett Friesen, actually shared an article with our leadership team actually today about languishing. And it was, it's kind of the new word to kind of safely describe how we're all feeling. Remember last webinar, I talked about panger, which is pandemic-induced anger. This languishing is more of a description between how people are feeling. And it's really about not thriving. So people aren't completely depressed, but they're not joyful, right? So they're in that space, and it feels a lot like you're walking through fog. You're not really seeing things clearly. You're not experiencing things clearly. Your thoughts aren't coming together as clearly as they could be. You're not making decisions quickly. Sometimes your favorite meal doesn't taste as good. I was talking about this with my husband and kids on the weekend, right? Because we're all doing well, we're functioning, we're coping through life, but it just doesn't feel the same. And that's languishing. And that's actually a great term to describe how we're doing and how most of us are feeling. Again, there's people that are really suffering. And then there's people that seem to be doing okay. Frankly, the ones that are doing okay are more on the introverts side of things that don't need people as much, right? But most of us are in that middle zone, and languishing seems to be an accurate description.
I tell people I'm an introvert, and for some reason they don't believe me. I am an introvert. A question someone had about the Moderna vaccine, very concerned that they might not receive the second dose because of shipment issues, and that is coming to Canada or by way of the US or another country. Dr. Mercer, can you comment on that?
Yeah, well, the first is that Moderna is a great company at producing the vaccine. They're just having what I call shipping issues. It's a fairly young company, and they seem to have difficulty negotiating the borders. And they should probably partner with Amazon. They would probably get a lot quicker. But so I don't have any doubt that they'll continue to produce vaccine and that this vaccine will be available. I know we keep getting it. It's really they just keep missing targets, but it's not about production. It's just about getting it to us. So let's hope they just get better at that.
Thank you for that. Anne-Marie, this question, you'll know this, you'll like this one. The question is about guidance that is needed for those with family members with a boyfriend or girlfriend or hookup. I haven't heard that term in a long time. She says, it seems that many youth in this age continue to mingle with their boyfriends, girlfriends, and hookups, whether it's in parents' homes or elsewhere, like vehicles or outdoors or elsewhere. It is natural they want intimate physical contact. How realistic is it for a pair of intimate 20-year-olds from two households to go weeks at a time repeatedly over last year without any direct contact? Is there particular messaging targeting this demographic? And what about guidance for their families?
So I'm not sure if there's particular messaging around this situation, but the 20-something-year-olds are going to decide whether or not it's fair to expect them not to get together. And if they're getting together, they've already decided it's okay to get together. I think if someone is already you know that someone is going to engage in a behavior that might be risky, the best thing to do is harm reduction. So not expect the 20-plus-year-olds who are already hooking up to no longer hook up, but make that hookup safer. And one way you might do that is to connect with the household that both people come from and make sure that the individual bubbles are tight and possibly ask people to get a COVID test so that they can know that as of this date, the couple is negative. And so you don't really want to give them permission, but you do want them to stay safe. It's like recommending a birth control pill to a teenager. You don't want to give them permission, but safety is much more important. And I think the 20-something-year-olds know what the restrictions are, and being safe is very appropriate. Finding a way to be safe is very appropriate.
Thank you. Helen, anything to add to that in terms of the mental health and emotional side?
I think that's a really good answer. And I would really just acknowledge that it's really tough, right? It's so unnatural for our 20-year-olds not to have that network and not to have that peer group around them all the time. Most of their life is outside of the home, away from their parents. And it's very unnatural to be living in this way. However, there are definitely ways to mitigate the risk and minimize it. And I think taking a different position that maybe as kind of traditional parents we're not used to, but embracing that person as part of your bubble, and then finding a way to go back and forth between the two houses and keep it there. So you're really minimizing the risk. We got to be realistic, and we have to give as much runway and room as we can without creating more risk.
Thank you. Thank you for that. Dr. Mercer, this question is one that you may or may not be able to answer. Maybe this is another discussion. It's an AstraZeneca question, but it's really specific to this woman's daughter who has an autoimmune disease and always had very severe reactions to all her childhood vaccinations. She's worried about her getting the AstraZeneca vaccine because of this, and she's always been one to get deathly sick with every virus going around. So she's not sure and about her picking up COVID, and talked about what could doctors suggest for her. She's 41, so she'll be a part of the new rollout of AstraZeneca in her age group. And I know that with yourself and Dr. Zajdlik and the conversations that you were having, I think there's a question around autoimmune diseases overall, and what is the best way and when will they be getting the vaccines?
Yeah, well, that's a really good question. So
Yeah.
sort of divided into a few pieces. So it sounds like there's a fear of vaccination versus a fear of getting a severe COVID. She's 40. I don't know what her profession is, if she's working from home or if she's out in the community, and that does make a difference. And for people who are listening, who you are essential workers, you can't work remotely, you have to go into work. That puts you in a really special classification of people who are very, very likely, as part of the job you do, the places you go, to sort of come into contact with COVID. What we do know is that people with autoimmune disease can be immunized. You absolutely can have this vaccine. You can have any of the 3 vaccines. And I think that the next part of that is, what was your reaction to vaccine? So if you have a specific allergy to a component in a vaccine, well, it's really important that you tell us what it is so that we can make sure whatever one of the vaccines are available, that you don't have that allergy. But if it's generally that, I'm just sort of reading in between the lines, that maybe you don't feel well with vaccines, or you have a local reaction, like your arm is sore. First of all, I'm going to tell you, you probably still are going to have a local reaction. I mean, that's pretty normal. We see a fair number of people have sore arms after these vaccines. Not everyone, but a lot do. And we do see people with, diarrhea. We see people with sort of headaches and sort of vague symptoms, not severe, but minor symptoms, aches, pains. But the majority, over 97% of all of the adverse reactions are all mild, like we would with any other vaccine. So my advice is, if you're eligible and someone offers you a vaccine and you're able to find it, to please get it. I think for everybody that's listening, I know sometimes we want to say, well, maybe somebody else is there that should get it, maybe I'll just wait my turn. But honestly, if you are able to receive a vaccine, if it's your turn, do your part, get the vaccine.
I'm getting my shot on the 23rd of April. I'm very excited. I've been looking forward to that very much so. Helen, this person says, I'm almost overwhelmed with fear and confusion. So they're probably a little bit beyond languishing. Rules seem to change at a whim. They're frightened for their family here in the north not having access to vaccines, and they just don't know what to do. The rallies of the anti-vaxxers who aren't policed makes her very, very angry, and wants to know, what can you do with this anger?
Great question. And you know what? It is a scary time. There is a lot of negativity. There's a lot of bad news and bad press out there. And so it's very, very easy to absorb all that and take it all in. There's a couple of really quick and basic CBT techniques, which probably all of us should be doing, frankly, right now. CBT is cognitive behavioral therapy. So cognitive is in the brain. It involves your thinking, which of course then impacts your behavior and how you act. So a couple things: journaling. So listing negative thoughts and reframing them into positive ones. You would be amazed when you write your thoughts down how many of them are negative, especially right now. If you have your TV on all day and you're watching the loop of CP24 or CNN or whatever channel, there, you would be amazed how much negativity is just unconsciously absorbed into the body and into your thinking. Shut that noise off and really monitor your thoughts. The second is doing some grounding exercises. So things like deep breathing, visualizing some imagery, relaxing your muscles. And it allows you to have a better sense of controlling your own body, and then a better sense of control that you have for the world. And I know sometimes people are like, oh yeah, breathing and imagery. There's actual science behind it, which shows mindfulness and meditation, how effective it is in terms of even reducing your blood pressure and your pulse rate and all kinds of markers in your body. And then the last is role playing. So if you walk through the worst case scenario, people often do this, for example, when they go to the dentist. They're terrified of going to the dentist.
Mhm.
They go to the dentist and they think of everything bad that can happen to them. And then they play out how they're going to manage it and how they're going to prepare for it.
Mhm.
And then they go in armed and ready for whatever might happen. And walking through that with a friend or someone you love or trust is really helpful. So then you're ready for whatever comes your way. Those
Mhm.
are things that are 3 basic techniques, but also very helpful in terms of just getting grounded and knowing what you can control and focusing
Mhm.
your energy on something positive. Of course, if that doesn't work on your own, reach out. I'll tell you, one program is
Mhm.
amazing called Bounce Back. It's a
Mhm.
Canadian Mental Health Association program all across Ontario, where you pick a goal. For example, it might be, I want to change my negative thoughts. You get a workbook, you get a phone coach, it's free and it's fabulous. So that's just one
Right.
example if you're not able to
Bounce
do it
back.
on your own.
Okay, thank you. Thank you so much for that. And I see bouncebackontario.ca. Thank you, Allison.
Amazing.
So folks can just Google that. Emery, you hear some people having reactions to vaccines, example, chills and aches. Does this indicate they'd have, the person says BEEB, I don't think they mean BEEB. Is that a reaction that's normal from being
Yes,
vaccinated?
absolutely. Absolutely. One of the main calls that we're getting on a daily basis from many people who've had the vaccine is
Mhm.
questioning whether or not their symptoms and side effects are okay.
Mhm.
A lot of people, most people will have pain and swelling at the site of the injection, right? Most people. If you touch the
Mhm.
area in the 24 hours after, it's going to hurt.
Mhm.
That's because the initial immune reaction is happening at the site of the injection. Many people have muscle aches and pains, feeling tired. That's very common the first few days afterwards. A smaller subset of people are getting low-grade fever that can last for 24 hours and chills. And some people are nauseous, but without vomiting. So all of those mild side effects are extremely common. I don't think there's any evidence that shows that there's a link between having side effects and your level of immunity. So that's a question that's been asked too. If I have no side effects, does that mean I have no immunity? If I have a lot of side effects, do I have more immunity? I don't think we know the answer to that.
It's good to know. Thank you. Thank you for that. Dr. Mercer, who's getting infected with COVID in Guelph? Can you share the latest about that?
Yeah, that's a great question. So it's quite different now than what we saw in wave 1, wave 2. Here we are in wave 3. So right now, I would say that the average age is between 20 and 39. Probably a slight predominance of males and females. And for the most part, they're what I would call my essential workers. So they're my manufacturing, warehouse workers, construction, people who are going into the workplaces. Most others are either working virtually or unfortunately they've been laid off because the business is closed. So really it's quite a shift from first wave, which was over 80. Second wave, we saw sort of a really a broad smattering, especially around Christmas, because people were getting together and socializing. So we were seeing like entire families, and now we're really seeing it in the workers, say age 20, anybody who's working age sort of even 20 to 50, that range there.
And then we have a couple of questions where folks are talking about, when we talk about workplaces in Peel and Toronto, they're closing businesses that have 5 outbreaks in a facility. And so the question is whether you're thinking of anything like that similar, or if there's anything that you can say right now.
No, I'm happy to talk about this. So actually, we have a really good relationship to all our businesses. So right from the get-go, if I have a business where they have 5 or more cases, and truthfully, right now I have 6 workplaces with 5 or more cases. Some of them have quite a few more than 5. We go in and we say, hey, you need to close this building or this line, or depending on where we are. Sometimes manufacturing, they have multiple buildings. Sometimes they have multiple shifts. Sometimes they have multiple lines. And to date, they've always cooperated. They've just said, yep, we're closing it. And we also go in and inspect. So our public health inspectors are there and try to help them to get back up and open. So the reason for an order is if people won't do what you're trying to get them to do. So locally, I would issue an order if I had a business where I said, hey, you need to close your line. And they said, no, we're not doing that. Well, I have the power to close them, But honestly, all of they know how serious this is. And we have just found, and we've been doing this for 8-10 months, working with our businesses, closing them, and they come back for 14 days, they come back, and it's been really collaborative, cooperative, and I don't see the need for us to have a random order when we can keep going with the relationship through our, because it is working locally.
Right. So you're saying it's not necessarily have to be out there that is the headline news. If we have that existing trusting relationship among community members and organizations,
I've
then
closed
things can
lots
work
of,
quite well. Yes.
Yeah, I've closed lots of businesses over the last 10 months, and you probably wouldn't have even known. It's just it's working together, and that's where I think that's because we live in Guelph or Wellington, right? It's great that we can actually know these business leaders and the businesses, and we can work together to protect the workers.
So if I could get up and do a happy dance right now, I would, because I think that what the medical officers of health have done in those 3 regions is a move that will protect the population, and that is their first priority. But it's also a political move that will put pressure on our provincial government to reconsider their stance on paid sick leave. There is a ton of pressure on them now. If you've got medical officers of health taking over where the provincial government has failed, so to speak, it's really time for the provincial government to adhere to the recommendations given by their scientific advisory groups. Happy dance.
Yes, and there's lots of calls for that. But we also saw on the weekend, I'm just going to share this very briefly, an observation that where people usually don't get involved politically and respond to what governments have done or orders that government has done, the random stop order, I have to bring that up because it created so much anxiety in so many people. I was on the phone, on Twitter, the entire day and emails of people being afraid and being scared, and for police officers, police services, for mayors and other members of communities to say this is wrong and we can't have this. That has made a huge difference, but it's done some damage, wouldn't you say, Helen, in terms of anxiety and how people are feeling,
particularly, Marva, for our racialized community who have suffered through systemic racism and are already vulnerable, that this is the group that would be even more vulnerable with those orders, right? I will say I was incredibly heartened by Chief Gord Kobe's response to that. He immediately stood up and said, no, we're not doing that, which I give him and his team great credit. Chief Brian Larkin in Waterloo Regions did the same thing. Again, that speaks to the knowledge that they have, that would take us 10 steps back from all the work that we've done this year. And Marva, you've been an incredible leader to get us there and to keep us moving there. This would have taken us 10 steps back, which they totally acknowledged and called out. And I was really heartened to see that.
Yes. And that's a side effect of even the pandemic. It's negative, but Anne-Marie, you can do a happy dance about that as well, that there organizations are coming together, are speaking out that ordinarily would not have spoken out. And so that was a really good thing.
If our political leaders have misstepped, which they often do, it's lovely to see local leaders, local organizations step in and say, no, this is not appropriate. And it also speaks to our democracy because they're listened to. They are listened to. Within days, they're listened to. That's lovely.
That's what leadership is, and that's how leadership is supposed to work. So it's great. So Helen, this person says, my parents in their early 70s both had their first jab of Pfizer, but are still terrified going out anywhere. She says, my mom has a bit of agoraphobia anyway. How do I get them confident that they can go for a walk at least, wearing a mask, of course?
Well, I think the main thing is right now is baby steps, right? So even, sensitizing them slowly but surely. And to be honest, right now, it may not be a great time to get them out right at this moment, just with the variants of concern being what they are. And, one shot, you might have a 60 to 65% protection. We'd love to see that up to 95 with the second shot. So baby steps, getting them outside just to sit on the front porch, or on the back steps or wherever you can. Maybe getting them into a car and going for a drive where they're still protected and they can go into the garage. Just, doing some of that would be really, really helpful. It's one of those things that with that kind of deep-seated fear and anxiety, you have to set realistic goals, right? We're not going to have them in the middle of the park with a picnic surrounded by 10 people on your first outing. That's a setup for failure. But we are going to take some baby steps just to get them comfortable, just to know that they're okay, and just to actually breathe in some fresh air. And then the next time you might go a few steps farther and so on. So it's setting small but reasonable goals and being with them all the way and naming what those feelings are. I forgot to mention that actually, Marva, when we talk about languishing, one of the most important things is to name it, not numb it. So we are so used to right now this year numbing our feelings, right? Because everything, it's like a wet blanket. This pandemic has been like a wet blanket on our life. So naming those feelings is really important as we start to work through them. And that example is just helping your 7-year-old parents name how they feel as you do those baby steps with them is really important.
Yes, and on the other side, those who want to bolt, they want to get out. Those who want to stay in and those who want to get out, the other side of it. Dr. Mercer, how do we deal with vaccine envy? This person says, as a recent cancer survivor, I've been watching all my other cancer buddies and other friends get their first and second shots. I've been waiting since phase 2 launched to receive my email. Any tips?
Well, I think if you're eligible, then we have a phone number, and I would encourage people to call. So it is possible. Sometimes it ends up in people's spam or it ends up in junk. We have found that. So if it's been more than say 2 weeks at max, and you thought that you should have got the call, especially if you're over the age of 60 and you registered and it's been more than 2 weeks, please give us a call. We do actually have people, we call it our white glove service. We actually have people that are calling all the people because we can tell somebody's registered and then somebody didn't book. So we're trying to call all those people. Sometimes it's hard to get through. Sometimes people don't answer the phone for us, but we are trying to make sure that we help everybody get vaccinated. So in this particular case, it sounds like you're eligible. Sounds like there's been a little glitch. Please give us a call. Usually we find the wait time is no more than about 7 minutes. It's not bad at all. So don't think you're going to be on hold for hours, and we'll get it sorted out.
That's great. Henry, asthma and bronchitis, that at-risk group, when might they be getting their call? Or
So
being registered even.
Swing this over to Nicola very quickly. Thanks, Marva.
I was trying to get you off the,
Stop typing questions. I think the asthma and bronchitis folks are at the tail end of phase 2, if I'm not mistaken, and Nicola might have a better understanding of when they might be called up.
Yeah, so phase 2 is a really big bucket. I mean, what we have in phase 2 is all kinds of things. We have health conditions that are graded highest risk, high risk, and at risk. And I would call bronchitis and similar conditions in the at-risk bucket. And then in that bucket, we also have large numbers of our essential workers. And they're in 2 buckets. They're in the first phase essential workers and the second phase essential workers. So really in that total bucket of people locally is probably around 30,000 people. So it's quite a large bucket, and congregate settings are in there. So as what we are trying to do, and also I guess now the hotspot communities, that's all in this bucket. So at risk, one of the ways is we in public health, we don't know that you've got bronchitis, but Anne-Marie, if she's your doctor, knows that you have it and that you're at risk. So our intent is when we get some Moderna, which hasn't arrived, but when we get it, is we want to distribute vaccine to primary care because primary care is the ideal group to be able to call their patients to say, hey, we think you're at risk and you would benefit from this vaccine. So that's really where we're going with that, recognizing that sometimes the mass immunization model works well for certain groups and it doesn't always work well for other groups. And so we have to be flexible and have different ways of people finding their vaccine.
On the heels of that, Marva, can I just make a comment?
Absolutely.
So you're talking about several streams of vaccinations, which I think people need to understand. You can enroll with public health, and that will get you into one of the mass vaccination clinics. And right now, they're offering the messenger RNA vaccines, which are Pfizer and Moderna. And then you can call your family doctor's office. Right now, some of us have the AstraZeneca vaccine available. The pharmacies are a separate stream altogether. So a lot of people are questioning that. It's like, why am I getting a vaccine with the pharmacy earlier than I am with public health? That's because the vaccines that are flowing to the pharmacies are flowing there as a separate stream than the stream that's going through public health. And the two are not really interfacing or communicating, which is fine. So if you can get an earlier vaccine through your pharmacy, go for it. But right now, that is just the AstraZeneca vaccine. I think very quickly they'll also have the Moderna vaccine.
Well, if we had it, yeah, I think they would too. And I would say for people who are wondering, what do I, I live in Wellington or Guelph or locally, what should I do? You can register with public health, call your pharmacy. You don't have to register the pharmacies. You can just, if you have a local pharmacy, give them a call, see if they have it, and or call your family doctor, see if they have the vaccine. So those are three places locally that have it. And if you register, we will get to you eventually when we get the vaccine. You will get the call. But in the interim, please don't hesitate. If you can get it at a pharmacy through your family doctor, go for it.
And some folks that are educational assistant have concerns that they're going into special education classes or those who are in daycare settings, and they're concerned about not being on a priority group. Can you address that a little bit?
So the special education teachers, the spec ed teachers that are not working remotely, so the ones that are actually going into the classroom are on the list to get the vaccine. And we were actually provided with the list from our school boards directly. So there wasn't a list that people could get on. The school board gave us the names, and those people were called. And they've all been offered appointments, quite a few. Actually, I think more than 60% have already been vaccinated. There were some who didn't want to drive, say, 30 minutes to Fergus. So there was a few people that wanted to wait for a few weeks to get their vaccine, but it wasn't that they weren't offered a spot. So all the special education teachers, by the names that we were given by the school board, have received their vaccine. Yeah.
Okay, that's great. That's good to know. This male person in his 40s is just starting radiation treatment for a recently discovered cancer. Can he be vaccinated while undergoing treatment? His doctor would have that response for him, his oncologist or otherwise.
Yeah, so he's got cancer, right? So he should be on the list. And so we should be, the cancer center is giving us the names of people undergoing treatment, and then we'll be calling and booking them. So he's definitely on the list, and he should get a vaccine. And if he finds that he feels like he's falling through the cracks, he can actually, his doctor can make a referral to us, because that's one of the times that we need to know that this person is special, is having radiation treatment for a malignancy, and he can get his vaccine locally fairly quickly.
That's great. Thank you. There are a number of this person said, I just left Costco, just got my shot. This would have probably been about an hour ago, maybe, and very excited about it. And the thanks again for providing this information to the masses, to our community. One of the questions here, Helen, languaging is a great word, exactly how I am feeling. And the person said yesterday, for sure, there was a lot of the languaging feeling that I had. And so it's very, very exciting. And yesterday it was sure, anger, anxious, mad. Never felt this way in wave 1 or wave 2, but feel that they're languishing in wave 3. And then another question is, what can we do to support students who may be struggling and starting to show signs of depression? A student being an A-level student last year is now failing. Can you comment on that, Helen?
Yeah, we're really worried about kids right now, and kids, particularly kids on our radar in terms of that, 6 to 18. So in our Children's Mental Health Service, we're seeing our referrals through the roof. We've never had such a demand for our child psychiatry service. as well as our children's mental health service overall. It's been really quite something to see. So first things we always tell parents is to really work hard to manage their own anxiety. Kids pick up your vibes and sometimes carry your anxiety as well as theirs. So we really always want parents to try and be as calm and that beacon of support as much as possible. Routines are so important for kids. And I know I probably talk about this every time when I'm mentioning kids, but it is so essential. If kids, especially in a time where kids can't control a lot right now, right? They can't control whether they're in school or not, whether they can go play with their kids or not, hockey games, all the things that bring them joy, they don't have any control over. So that routine is important because then they can predict their day. They know when they're getting up, what they're doing, what time they go to bed, they're going to have a book before bed, or all of those things. It gives them that sense of security and predictability, which they're definitely missing. Sometimes, parents want to enforce all the rules, which they normally do. And right now we're seeing really, have a path of least resistance. If your child has more screen time, that's okay. If they need things a little bit different out of their regular routine, that's okay. Pick your battles. Certainly don't pick every battle. That's important. And I would really say you don't need to do this alone. If you're worried about your child, or if your child wants someone to talk to, there are supports certainly in place. Our Here 24/7 service is available. You certainly can call your family doctor if you're concerned. There is appointments and opportunities through family counseling and support services. The school board has all kinds of supports as well for kids. And we also have the website, right, that we have put up, which is called Here for Help, the number 4help.ca, which lists all kinds of things that you can do with your kids to support them as well.
Thank you. That's Here 24/7 .ca or 1-844 HERE, HERE 247.
Yeah.
And so that will be on the website as well for CMHA.
You can
Here
literally
for Help.
call our service at any time. Like if you're a parent and you can't sleep at night because you're
Yes.
so worried about your child, it's 3 a.m. Give us a call. We'll walk you
Yes.
through that. We'll help you determine how worried you should be and then match you to the right service. And then hopefully you can get back to sleep.
Great. Thank you. Thank you, Helen. The question about AstraZeneca, this person feels that the risk for women on hormone replacement therapy was not addressed and has asked politely if we could just pick up that thread. I am not sure if this is something that could necessarily be addressed on this forum, but I'm going to throw it out to Dr. Zajdlik and Dr. Mercer, and you can arm wrestle over who's going to respond to that.
So again, Dr. Mercer and I had this conversation before we started the webinar tonight. The Society of Obstetrics and Gynecology of Canada, SOGC, has put out guidelines that say, get the first vaccine that is offered to you, whether you are on oral contraceptive pills or on menopausal hormone replacement therapy, because the risk of getting clots if you get COVID and the risk of serious side effects is far greater than the risk of getting the unusual clots associated with AstraZeneca and possibly the Johnson & Johnson vaccines. I don't think the research is done yet to show that the people who have VITT, V-I-T-T, that more of them were on any kind of hormones. My feeling is, and Nicola, you can comment on this, that there just haven't been enough cases yet to determine if there is a higher risk if you're on hormones.
Yeah, this is certainly an area that they're really researching in order to understand why do some people get this and some don't. It tends to be in younger females, but honestly, it's also in older people and in males. So that's not an exclusive club. So it's not necessarily being on hormone replacement therapy. So more on this to come. But honestly, given the big picture, given where we are in a pandemic, with the circulating variants, with what happens when people get these variants, some people get really, really sick and they can be young when they get it. So it's not the old people now, it's not your grandparents' disease. Now we're talking about the new disease. This is a time to say, have the discussion with your caregiver, but if you can get the AstraZeneca, weigh the risk benefits. As I said, I give vaccines all the time for yellow fever and it's 1 in 20,000 and people say, oh, up my sleeve, I want to go on my holiday, and And here it's 1 in 250,000, and it could save your life.
Mhm. Thank you for that. I want to ask a question about hotspots, and there's a mental health side, an emotional side, and then there is a physical health side. And some folks are not sure why certain areas are hotspots and what that means. Those who live in a hotspot might feel a stigma. Suddenly people are looking at them differently. Why am I in a hotspot? Is it because I didn't care enough, didn't get vaccine, or that I am transmitting the disease? Can you respond about how the decision for hotspots? I live in N1K. I was told by Danny Williamson that he and I are neighbors. And so even though I'm in N1K, I'm not really in the hotspot, but nonetheless, you know, you wonder if someone is going to say to you one day, and what's your address again? N1K. Oh, well, we don't want to talk to you. Can you share a little bit about hotspots?
I should probably take this one. So really the term hotspots, that's interesting. So, and the way they were found was looking at areas of higher incidence of COVID-19, so numbers of cases, as well as hospitalizations and poor outcomes. So really they combined it all together. Now, the unfortunate thing about hotspots is they use the first 3 numbers of postal codes, which are really big areas. So what I like to say is it points you in a direction, but it doesn't actually tell you everything. So in Guelph, in the public health, we go by something much smaller, much finer. It's called a DA, or you might call it a neighborhood. So we all know, if you live in Guelph, you can think about, we all know that there are neighborhoods where there are high numbers of apartment buildings. There are neighborhoods where people live in multi-generational families. There are neighborhoods where lots of people have jobs where they're working in the factories or warehousing or manual labor. Those are those types of jobs. So you can think about that. Those are the neighborhoods where we tend to see more COVID. The people have to go to work, and when they come home, they might live with more people in their family, and it's harder for them to self-isolate, and there may be greater exposures in the community they live. So it's not really, don't worry, Marv, it's not about being in N1K. Everybody in N1K is not at risk, but it's neighborhoods. And sometimes, honestly, they have missed parts of our community that are the same. So there are parts of N1K, but there are also parts of Guelph and Wellington and Dufferin that look just the same as parts of N1K. And they have the same risk. So in public health, behind the scenes, when we're looking at where the disease is, just because you're an N1K does not mean you're our only internal hotspots. We've got lots of neighborhoods where we're keeping an eye on and trying to make sure that we target vaccine into those communities to keep those people safe. Oh, you're on mute. You're on mute.
Thank you for that response. And for me, part of the reason, that's going to be my gravestone. You're on mute. There are folks who live in the area, whether it's the hotspot or not, that have to go up to work, as you said. And many of these are the frontline workers. And I just don't want to see people re-stigmatized that are really some of the folks that are providing the supports that we need so that we can live our lives, whether they're at the grocery stores or at Linamar or one of the other organizations, or have to take public transportation. Those kinds of discussions I was having with someone a young woman named Chelsea, and she articulated so beautifully as a representative for Parkwood Gardens area, what being in a hotspot and what COVID-19, the challenges that is faced by so many people on COVID-19, people who would go to work, or they need food, or they need support, but they're so proud and they're working hard to be self-sustaining that they wait until the very, very last thing in the cupboard before they ask for help. And that's very, very hard to hear that that's still happening in our community. And there are wonderful organizations like Hope House and others that are working to provide support to many of these and Shelldale community centers. So it really is sort of important to encourage them at the same time. And it's an asset as opposed to a deficit from our community. I just want to shout out all those N1K folks who are working hard to keep us safe. Thank
And
you
it's
for that
important.
response.
And it's important for people to register for their vaccine, because
Yes.
people don't know if the neighborhood that they live in is not something that we've got our eye on in public health. And so if you
Yes.
register, you may be surprised that you may get invited to book an appointment
Yeah.
if we've determined that your neighborhood has low vaccination rates and high rates of disease. Then that's what we're looking for. So everybody should register. And if you have people that you can help to register, that's even better too.
No, that's great. Thank you. I've had a few questions about daycare. This person says her 3-year-old granddaughter is in daycare where one of the children's parents was tested positive for COVID. The family has chosen to just isolate instead of testing their children. But should the other attending children in the daycare be tested? So the family's chosen to just isolate instead of getting the child tested, even though the parent has COVID-19.
So the child, if they develop any symptoms, will just be assumed to be like, if just because you don't get your child tested doesn't mean that we don't move along and assume the child is positive.
Right.
And then based on the timing, so public health will follow up with the family. So a lot of it's based on timing as to when
Yes.
the dad got tested positive, you know, if it was on a Friday, or maybe the kid wasn't in daycare on the Friday. Like we work backwards. And so it is possible that we could ask the whole cohort to stay home, but that will be whoever is doing the case contact management will determine that.
And for that one, that is great. So we're at 8:05, and I know that folks want to hear some of your closing remarks and your encouraging words as to what we stand to see from now going forward. And I'm going to go the other way around and maybe ask Dr. Mercer for her comments, and then Emery, and then Helen, the final word on how we can languish or not. How's that?
Yeah.
Dr. Mercer, please.
Well, and just so everybody knows that sometimes I feel like I've been languishing too over the last year. It's been a very long year, and I think I'm equally sick of this pandemic and staying home as everybody else. What do I see? What is my little crystal ball? Guys, I think we honestly have a few weeks ahead of us where things are going to be tough. Okay, so I think that we're going to see around the May 2-4 weekend, that weekend, we're going to see a significant change and improvement. My own personal belief is, and maybe it's also my own personal hope, but I do believe that this is our last lockdown, because as we come out of this, we're going to be coming out into significant amounts of vaccination. I think by the first week of May, about 40%, end of that May 5th, about 40% of Ontario will be vaccinated. And if we keep moving forward, sort of get closer to the May 2-4 weekend, end of May, we'll be getting on to 60%. So we're coming out of this into a totally different place than we came out of the second wave. So hang in there. Just keep your eye on the prize. When it's your turn, roll up your sleeve and get your shot.
Yeah.
And Dr. Mercer, you certainly are our local hero. We thank you so much for your leadership through this. I'm not sure that we could really get through in the way that we have without leadership such as yours. And it's just perfect timing. And we're really, really happy that you are where you are. And we're here to support you and support your work and support your team. I know the last time around that we spoke, we had some concerns about phone calls and the harassment that was happening with staff and messages that were being sent. We hope that that is reduced now. And we're here to cheer you on, and we're here to cheer them on. So thank you so much. We really appreciate your work. And thank you for coming again twice in 1 month. We're very lucky. She's not going to be back. She's not going to be back for May, I don't think. But if she is, we'll welcome her nonetheless. First week of May. Dr. Zajdlik, please.
So I think it's very important. I totally agree with Nicola. She gave some stats for the province. May 5th, 40% vaccinated. End of May, 60% vaccinated in the province. And I'm going to say that in Guelph, Wellington-Dufferin, we'll be ahead of that curve because we are doing so well in this community. And that's the result of really good leadership, really good partnerships, and having Dr. Mercer in the lead. And I agree. I think it's going to look totally different by the May 24th weekend. Is that about 5 weeks away? we're going to have such a boost in our mood and our outlook, in our sense of hope, as a result of seeing the numbers fall and seeing how we have begun to overcome COVID. Countries that are at 60% are opening up. Countries, there's only one, I think that's at 75%, and that's Israel, is completely open. So it's going to be a while that we need to adhere to restrictions, but man, we are in good shape, and we are in better shape than we could ever have imagined this time last year. Much better shape. That sounds crazy given the fact that there's this horrendous third wave with COVID variants, but in the background is this huge amount of positivity.
Thank you so much. We appreciate that. Yes. And now over to, and I'm going to say the same thing to you as well, because a lot of the comments that have come through are, Cassia has decided that the webinar is over. So
that's your granddaughter.
So that's who's running around behind me. She's decided that the webinar is over. She's not going to languish any longer. She wants her Nana. Yeah. But for those who find so much comfort in your Facebook messages and your continued advocacy on behalf of our community, a lot of them have put messages in the chat, and certainly messages in the chat for all three of you and the work that you're doing to get people through. And so I think when, I think it was Tracy and maybe Helen conceived of this, and maybe you as well, Anne-Marie, conceived of having this session way back in June when this got started, had no idea that we would still be doing this now. Mm-hmm. And at 100,000 people. And I think, Anne-Marie, at last count, the last Facebook views were topped over 30,000 from people who really wanted information. Yeah. We recognize that people want information. We are volunteers, and this is for us as a service, as part of our community. We certainly are appreciative of the opportunity to be able to provide some counsel, some advice, some support, more than anything else, support for all of our community members. Helen, thank you.
Thanks, Marva. And exactly what you're talking about is how we're going to get through the next 5 weeks, for sure. Coming together, making sure we have accurate information that is reliable, making sure that we know what we need to do to stay the course and to do it together. That's why people join us for these webinars, because there's a sense of fulfillment, purpose, hope, and to know that we're all in this together. I mean, let's be honest, there is a parallel pandemic happening, and that's mental health. It has been an absolutely brutal year for our mental health. And the next 5 weeks is not going to be easy. So that's the other thing we've always done in our webinars, is we've just called it what it is. This is not an easy part of our journey. So more than ever, we're going to need each other to get across that finish line. We're in the last 5 miles of the marathon. We can see the finish line. We know the vaccines are going to help us across, but we also know that there's long-term effects of the last year. And it's not going to be a quick switch and we'll all be feeling better and we won't be languishing anymore. It's going to take us a while to recover, and we're going to need each other. So my thoughts and advice this month for sure are not to numb those feelings, but to name it, to get real with how you feel, and to really increase your bubble of support. Even though it doesn't mean you need to bring people into your home, but please bring people into your heart, because that's where you need the support, and there's lots of ways to do that.
Not to bring people in your home, but bring people in your heart. That is beautiful and well said. Just want to thank some of the folks in the background, especially Miss Allison, who makes sure that we're all organized and getting all sorted. Yes, applause, applause. Thank you so much, Allison, and Tanya as well, who does such great work and ensures that things are sorted and that the questions are here. Just to let you know that we answered one more question than we did last time around, which is really great. So we're getting better. It's more than 66 questions. It is a lot, and we know that there's still more questions. There's some overlap, but we did our best to answer as many as we possibly could. We hope that you have found information that will be helpful to you. We thank you for joining us, for supporting other members of the community. And May 4th is the first Tuesday in May. And we will have this again with another guest. Again, it might be Dr. Mercer. No, I'm putting her on the spot, I'm teasing her. But we thank you for joining us. And with that, we're going to say good night. And we'll see you again. Stay safe. Wear your mask. Double up on the mask. Wash your hands. Safe distance. Stay at home. Stay at home. We really appreciate it, and we appreciate you. Good night,
Thanks,
everyone.
Marva. Thank you.
Thank
Thank you,
guys.
Marva.
Thank you.
Awesome job as usual.
Yes, as usual.
Thank you. And we're off. Guys, happy. Thank you. I can't leave. Are you still on, Helen? I can't get off.